understanding ovarian cancer, vague symptoms, key risk factors, and treatment approaches on Health Sphere. Welcome back to Health Sphere. Today we're discussing a crucial women's health topic: ovarian cancer. Often referred to as a silent killer, ovarian cancer can be challenging to detect early due to its sometimes vague symptoms. However, understanding the potential signs, knowing the risk factors, and being aware of treatment advancements are vital for increasing awareness and improving outcomes. Ovarian cancer is a type of cancer that begins in the ovaries, the female reproductive glands that produce eggs and hormones. It can also start in the fallopian tubes or the peritoneum, which are often grouped with ovarian cancer due to similar cell types and treatment approaches. The challenge of vague symptoms. One of the most significant challenges with ovarian cancer is that its early symptoms are often subtle, nonspecific, and can easily be mistaken for more common, less serious conditions. Unlike some other cancers with clear early warning signs, ovarian cancer symptoms can be vague abdominal or pelvic discomforts that many women experience regularly. This can lead to delays in diagnosis, often until the cancer has spread to other parts of the abdomen and pelvis. While there is no reliable screening test for ovarian cancer for the general population, it's crucial for women to be aware of the potential symptoms and to seek medical attention if these symptoms are new, persistent, and not easily explained by other causes. Common symptoms of ovarian cancer, which are often persistent rather than occasional, include bloating, persistent abdominal bloating or swelling that doesn't go away, pelvic or abdominal pain, discomfort or pain in the lower abdomen or pelvic area, difficulty eating or feeling full quickly, feeling full after eating only a small amount of food or a loss of appetite, urinary symptoms, needing to urinate more frequently or urgently than usual. Other less common symptoms can include fatigue, back pain, changes in bowel habits, unexplained weight loss or gain pain during sex, menstrual changes, abnormal vaginal bleeding. The key takeaway regarding symptoms is their persistence and change from normal. If you experience any of these symptoms on most days for several weeks, it's important to see a doctor, even if they seem mild. Keeping a symptom diary can be helpful to track when symptoms occur and how long they last before your appointment. Understanding the risk factors. While the exact cause of ovarian cancer is not fully understood, several factors are known to increase a woman's risk. Being aware of these can help you have a more informed conversation with your healthcare provider about your individual risk. Risk factors for ovarian cancer include age. The risk of developing ovarian cancer increases with age, with most cases occurring after menopause, particularly in women over 60. Family history and genetics. A strong family history of ovarian, breast, uterine, or colorectal cancer significantly increases risk. Inherited gene mutations are responsible for a substantial portion of ovarian cancers. BRCA1 and BRCA2 mutations. These are the most common gene mutations linked to hereditary breast and ovarian cancer. Women who inherit mutations in BRCA1 or BRCA2 have a significantly higher lifetime risk of developing ovarian cancer. Lynch syndrome. This inherited condition also increases the risk of several cancers, including ovarian, colorectal, and uterine cancers. Other gene mutations. Mutations in other genes like RAD5RC, BRAD51D, BRIP1, and PALB2 have also been linked to an increased ovarian cancer risk. If you have a strong family history of these cancers, genetic counseling and testing may be recommended to assess your risk. Personal history of certain cancers. Having had breast, uterine, or colorectal cancer can increase the risk of ovarian cancer. Endometriosis. Women with a history of endometriosis have a slightly increased risk of certain types of ovarian cancer. Reproductive history. Never having a full-term pregnancy or having a first full term. Pregnancy after age 35 is associated with an increased risk. Never having used oral contraceptives. Using oral contraceptives for 5 years or longer has been shown to significantly reduce the risk of ovarian cancer, and this protective effect can last for many years after stopping the pill. Experiencing menopause at a later age. Obesity. Being overweight or obese is linked to an increased risk of ovarian cancer. Hormone replacement therapy. Using estrogen-only, HRT, or combined estrogen-progestin. HRT after menopause may slightly increase the risk of ovarian cancer, particularly with long-term use. The increase in risk is small, and the decision to use HRT should be discussed with a doctor considering individual benefits and risks. Smoking. Smoking may slightly increase the risk of certain rare subtypes of ovarian cancer. It's important to remember that having one or more risk factors does not mean you will definitely get ovarian cancer. Many women with risk factors never develop the disease, and some women diagnosed with ovarian cancer have no known risk factors. Treatment approaches. A multimodal strategy. Ovarian cancer treatment is complex and typically involves a combination of surgery and chemotherapy. The specific treatment plan depends on the type and stage of the cancer, the patient's overall health, and other individual factors. Treatment is best managed by a gynecologic oncologist, a surgeon specializing in cancers of the female reproductive system. The main treatment modalities for ovarian cancer include surgery. This is usually the first step in treating ovarian cancer. The goal of surgery is twofold: to accurately stage the cancer and to remove as much of the cancer as possible. A procedure called debulking or cytoreduction. The extent of surgery depends on the stage and spread of the cancer. For early-stage cancer confined to the ovaries, surgery may involve removing one or both ovaries and fallopian tubes, and potentially the uterus. In young women who wish to preserve fertility, in very early-stage cases, surgery may sometimes involve removing only the affected ovary and fallopian tube. For more advanced cancer, surgery is often more extensive and may involve removing both ovaries, fallopian tubes, the uterus, the omentum, nearby lymph nodes, and any visible tumors in the abdomen and pelvis. The goal of debulking surgery is to leave behind as little cancer as possible, as this is associated with better outcomes when combined with chemotherapy. Surgery may be performed through a traditional open incision or in select early cases, using minimally invasive laparoscopic surgery. Chemotherapy. Chemotherapy uses powerful drugs to kill cancer cells or stop them from growing. For most types of ovarian cancer, chemotherapy is used after surgery to destroy any remaining cancer cells that were not removed during the operation. This is called adjuvant chemotherapy. In some cases, particularly with advanced disease, where surgery might be difficult initially, chemotherapy may be given before surgery to shrink the tumors and make them easier to remove. This is called neoadjuvant chemotherapy. Ovarian cancer chemotherapy often involves a combination of drugs, typically including a platinum-based drug and a taxane. Chemotherapy is usually given intravenously in cycles, with periods of treatment followed by rest periods. In some specific situations, chemotherapy drugs may be delivered directly into the abdominal cavity after surgery. Targeted therapy. These newer drugs target specific molecules or pathways within cancer cells that drive their growth and survival. Targeted therapies are increasingly used in ovarian cancer treatment, particularly for advanced or recurrent disease. PARP inhibitors. These drugs block an enzyme involved in DNA repair in cancer cells, making it harder for them to survive, especially in cancers with mutations in BRCA genes or other genes involved in DNA repair. PARP inhibitors are often used as maintenance therapy after chemotherapy for certain patients with advanced ovarian cancer, particularly those with BRCA mutations. Anti-angiogenesis inhibitors. Drugs like bevacizumab target the blood vessels that supply tumors, cutting off their nutrient supply. Bevacizumab may be used in combination with chemotherapy or as maintenance therapy in certain cases of advanced or recurrent ovarian cancer. Other treatments, hormone therapy, rarely used for the most common types of ovarian cancer, but may be an option for some rare subtypes. Immunotherapy. Treatments that help the patient's immune system fight cancer are being studied in clinical trials for ovarian cancer and may be an option in select cases. Radiation therapy. Not commonly used as the primary treatment for ovarian cancer that has spread widely, but may be used in specific situations to treat isolated areas of cancer or manage symptoms. Living with ovarian cancer. An ovarian cancer diagnosis and its treatment can have a significant impact on a woman's life. Managing treatment side effects, addressing the emotional and psychological aspects of cancer, and coping with potential long-term effects such as early menopause or neuropathy, from chemotherapy are important parts of care. Supportive care, access to resources, and connecting with support groups are crucial. Conclusion: ovarian cancer is a challenging disease, largely due to its often vague symptoms that can lead to later diagnosis. However, increased awareness of these persistent symptoms, understanding the key risk factors, being informed about the evolving treatment landscape are vital. While there is no general population screening test, being attuned to your body and seeking prompt medical attention for new and persistent abdominal or pelvic symptoms is the most important step you can take. For those with significant risk factors, particularly a strong family history, discussing genetic counseling and potential risk-reducing strategies with a healthcare provider is highly recommended. With ongoing research and advancements in surgery, chemotherapy, and targeted therapies, the outlook for women with ovarian cancer continues to improve. Thank you for joining us on HealthSphere. Stay informed, listen to your body, and consult with healthcare professionals for personalized medical advice and care. This video provides general information and is not a substitute for professional medical advice. Always consult with your doctor for diagnosis, treatment, and personalized recommendations regarding your health situation.